Moving on to number 61. 61 is one leg toe touch with 3 cones and the knee up. This one, we haven't done this one in a while, but you can use 3 items. Let's say we've got 1, 2, 3. And while one person is on one foot, they're gonna touch, bring their knee up. Touch, bring their knee up. Touch, bring their knee up. And then they can do it with the opposite hand. Touch, knee up, touch, knee up, touch, knee up. And then the other side with the other leg on one. Touch, knee up, touch, knee up, touch, knee up. And ideally you want to do this without having to put your foot down, but if you have to, you can put your foot down. That is your toe touch with the 3, we have it cones, but it could be 3 items, anything really. Then there's the 3 C's, which is the cat, the camel, and the C. The way this is done, patient's going to be on their hands and their knees. They're going to let their stomach sink down, head up. That's the cat, this is the camel, and then the C is taking your hands and walking all the way over to where you can look at your feet. Coming the other way, look at your feet. So you've got the cat, the camel, and then the C. That's the 3 C's. That's performed for 2 to 5 minutes as prescribed. And then we've got toy soldiers. This is number 63. Forward and back. So this is really good, especially for children who have a lot of cross-crawl coordination issues. First way to do it, the easiest way to do it, is straight arms, straight legs. They're going to point to their opposite toe while they walk. And most kids, if they have problems with it, will point to the same toe. They can't figure it out. So we're going to get them to walk all the way down the hallway, pointing, 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 pointing. If they want to and they get really good at it, they can actually touch. So as they step, they can touch, 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 and they can do it backwards. So they can point to their opposite foot backwards as they walk, and they can even touch. Touch, 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 okay? That is 63. That's very good, especially for children. Then there's 64, which is the lacrosse tennis ball. I will tell you where to do this. We have 2 of them. We have a double ball and we have a single ball. Double ball is just easier. So if someone, I say 64 to the shoulder, they can put this against the wall and they can roll into their shoulder into all different parts. They can put it at different angles and they can really dig into those muscles with this. They could do it with a single ball as well. Dig in. If I say it on the hip, they can do it on the hip and dig into the hip on the wall with the 2 or even the 1. And that's sometimes easier for people who can't get on the ground, but if they can, well, the ground gives a whole lot more resistance. So if they wanted to do their hip, let's say with the double ball, they could put their hip into here and while laying on it using their body weight, really dig into that hip, dig into that glute. Or they can do it with the single ball. Put that in there and just move around. And when they feel a spot, tell them to kind of sit there for a little bit. Let it ease up and move around. Ah, there's another spot. And let it ease up. That's very powerful, breaking up adhesions, trigger points, as well as muscle. That is number 64. 65 is the finger wall crawl. So for people with shoulder issues, facing the wall, putting their hand out where they can touch the wall, they're literally going to start at the bottom and finger crawl like a spider all the way up, and they can lean in as far as they can go and then walk all the way down. They can do the same thing to the side, walking their fingers all the way up. If they can lean in a little bit and all the way down. They can do it from behind, so they can crawl with their fingers as far up as they can go. And if they get stuck and like that's as far as I can go, hang out there for a second, let the tissue relax, see if you can go a little bit further, okay? And that goes in all the directions. That is the wall crawl, known as finger wall crawl, number 65. 66 is a stand-up sit-down with a kettlebell. This is really good. Particularly, I will do this in a regular chair, but for now I'll demonstrate on a kettlebell. I'm on a gymmic ball with the kettlebell. So they're going to stand up and sit down. If you do this with a ball and that ball rolls away, they're gonna eat it. But I'm showing you right now on a ball, but I would have them just do it on one of our regular chairs, okay? The other thing you could do too is trying to do it without, I'll show you here, without using your hands or your body. Literally just stand up and sit down. Stand up and sit down. Key 7 is the finger hand stretch. So finger hand stretch is done as follows. Palm up, grab the fingers, stretch. Hold it for a minute. Palm down, fingers back. Let it go. Palm down, stretch this way. Okay? And it can also be done turning your palm this way, turning your hand that way, but typically done like this, like this, like this, and like that. That is the finger hand stretch. All right, we're gonna go over number 68. This is the posturmetic exercises for posture-related issues. And they are done as follows. Arms up, palms out, like this, and stretch the chest by bringing the arms back around, making little circles, but bringing it back. They can open it up if they want to, but it can be done just here. Second part is gonna be stretching the lats, moving it this way, side to side, opening that up, okay? Third thing is gonna be with the hands behind the back, palms out here, you're gonna be lifting the arms as far back as they can go with pressure, pushing out, shoulders back, lifting that up as high as they can go, and relax. Do that over and over again to work those muscles. Next one is going to be similar to the band or rear delt exercise in number 3, bringing this back across the chest and squeezing that with the shoulders back, head up, bringing this into good posture in that regard. Then there's also external rotation. So arms are here, you're going to be externally rotating with your elbows pinned into your sides. If it's too tight, they can also do it like this, putting it on here, if it's easier for them, okay? And the third exercise is going to be pinning it to one hip and bringing this up over the shoulder. Up over this way, holding this to the hip, up over this way, working those muscles as well. That is number 68, which is your posturmetic exercises to strengthen the posture, as well as when they go home they can wear one of those. So that's 68. Now 69 is a Russian twist on the floor. Basically, sitting with your knees bent this way and this way. If they're good, they can lift their feet and do this. 2 to 5 minutes as prescribed. That is 69. And last but not least is 70, which is the elbow series. I'm going to save that with 68 on the next video. All right, this is number 70. I'm going to show you with the TheraBar for people with medial or lateral epicondylitis. This is your TheraBar, and this is a very useful tool. If it's the lateral, meaning the outside, medial, meaning inside, depending on which one it is. So if they have lateral epicondylitis and we'll notice it's 70L, they're going to take the TheraBar and roll on the outside of that elbow. If it's 70M, they're going to roll on the inside of that elbow. Okay, and do that for about a minute. Loosen up the tissue, get some blood flow, and myofascial adhesions broken up. Next thing you're going to do if it's a lateral, so I'm going to treat this as if it's a right arm. Right arm's going to hold it like this. Left arm's going to come out. You're going to twist and bring it here, and then you're going to let it ease or eccentrically contract into this position. So again, hold it here, grab like this. There's going to be a twist in the bar, and then let the twist come out slowly and controlled with the arms extended out. That's going to elongate, contract, or eccentrically contract that. The other thing you do too is while the arms are out, they can twist or pronate the wrist like this, making sure it's coming from here more than here. You don't want anything moving in the shoulder. If they have to, they can keep it at their side and work on twisting this way. That's for lateral epicondylitis. For medial epicondylitis, this is a little bit trickier. This is on this side. What you're going to do is you're going to hold it like this, thumb here, twist is here, and as it unravels when the arm's out, it's going to slowly go that way, and that's going to work this side here. So again, hold it like this, there's a twist, hold it out, and then let that arm slowly unravel. Also from this position, we're going to do a supination, which is twisting over this way, and they can do it in here. also after they rolled it. That's for the medial epicondylitis. That's number 70. The McKenzie exercises. McKenzie exercises are done with a patient lying prone. First part of it is literally lying prone, letting everything kind of relax. From here, they're going to go up onto their elbows. Step 2 is the elbows, and they're going to stay here for a minute. Well, actually 30 seconds at a time, up to a minute, and then back down. And then come back up, which seems very benign, like it's not going to do anything, but it actually is helping push that lower back disc, if they have a disc issue, back in place, and they'll usually notice a decrease in symptoms radiating or radicular down into their legs. And the third part of the exercise is coming from this position after they've relaxed, using their hands and pushing up into a cobra pose as much as they can. They may need to come down a little bit, but ideally they want to hold this for up to 2 minutes, but sometimes they'll have to do 30 seconds at a time, as long as it's not increasing pain. If it is, they'll need to back down, rest, and then do it again. That is the first 1 through 3 of the McKenzie exercises. There's 4 through 7, but I rarely have patients doing that. That's number 71. 72 is the dead bug. Dead bug is lying on their back. If they can do it on a ball, even better. Arms and legs up in the air, and they're going to do opposite arm, opposite leg, reaching up, okay, like that. That's dead bug. Then, let me make sure I've got everything on the dead bug. Yep. You can do it with both arms. There's variations. You can do it with both arms and both legs at the same time, but typically I like cross crawl stuff for most of it. 73, which is the voodoo board. This is a voodoo board, a balance board. It looks like a skateboard. In fact, it was, I guess, designed out of a skateboard. Going onto this. Patient is going to stand here. You may want to hold their hands, and what they're going to do is they're going to try to get onto balance on this board, okay? And once they're on here, they can usually, it's been a while since I've been on here, work on their centering. If they get really good at it, they can do air squats on it. But ideally, you want them to stand on the board for a little while like this and just work on their balance. If they can do squats on it, great. If they can't, just standing on it and just going back and forth. Back and forth. Is very good. Good coordination, good balance, okay? Especially for our skateboard, snowboard crew. That is the voodoo board. That is number 73. Moving on to number 74 is the pigeon pose. Done with a patient on the ground like this. This is a yoga pose, and this is going to open up these hip rotator muscles. You can see like this, okay? If they can't do this for whatever reason, if they can't get onto the ground to do this, the other way to do it is on a chair or a ball where they're going to sit like this, keeping their chest up and bringing their chest to their knee. They're going to feel that hip open up as well. That is number 74, pigeon pose. 75, the pubic groin abduction. I'm sorry, yeah, adduction, not abduction, adduction. It's written wrong on the sheet. Okay, so 75, you're going to squeeze with your knees straight 20 times. Toes in 20 times. Toes out 20 times. And toes or feet angled out 20 times. What this is going to do is going to stimulate the muscles of the groin, the pubic bone, as well as the pelvis for people who have pelvic and back related issues as well. 76 is the 3 Ps, the push-pull pubic. The push-pull pubic is going to be done with a patient lying on their back, on the ground, knees at 90, 90. They're going to stabilize one side and push down on the other. So there's going to be a push-pull without motion. And tell them, push-pull without motion, hold that for 10 seconds, switch. Grab this side, push down. 10 seconds, switch. Do this a number of times, probably 3, switch. Okay, after you've done your push-pull, 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 2 hands together like this, and squeeze. Hold that for 10. Squeeze. Hold that for 10. So push, pull, squeeze, push, pull, squeeze, push, pull, squeeze. Should take them about 2 to 5 minutes as prescribed. That is number 76. Number 77 is a hip band opener. Lying on the ground, using this black strap. This is going to go as low as they can get it into their groin and hip. And while they're here, they're going to then traction out so that there's traction pulling their hip joint out a little bit. And they're going to literally just stretch and stretch. They can roll around a little bit. They can move. They can turn it a little bit. This is really good. This is a nice hip opener. Turn it to the outside. Turn it to the inside. Turn it to the outside. Down a little bit and up. And they can stretch while this is pulling down, especially for people who have particular hip issues. This is a fabulous thing to do. That is number 77. All right, here's a new one that I'm going to add. It's called number 78. And this is for opening up the shoulders and the thoracic region. You're going to lie on your back with this at the scapula or just below the scapula with a ball or a kettlebell. And you're going to reach back as far as you can in this position, letting everything, let your shoulders and arms go heavy. You can roll a little bit forward or a little bit back like this. You're going to hold this position for 2 minutes. This is going to help open up your thoracic cage, your ribs, your shoulders, as well as help your posture. You're going to hold that for a minimum of 2 minutes.